Today's conversation is going to be seriously hilarious. It's March, guys, and it is Colorectal Cancer Awareness Month. And so I asked Dr. Beth Moore, who's a colorectal surgeon at Cedars-Sinai in Beverly Hills, to come talk to me about everything from farting to cancer. And that's exactly what we did. Hope you enjoy it. The Nikki Alpert podcast is brought to you by the Empowered Cookie. These cookies are soft-baked, they're moist and they're chewy, and they're packed with gourmet, gluten-free and paleo, low-carb, high-fuel nutrition. Get empowered by making the clean, lean, healthy choice of the delicious Empowered Cookie. Go to empoweredcookie.com and use my code Nikki25 for 25% off your purchase. I promise you.
Hey, baby, it's time for the Nikki Alpert podcast. Come on, pull up a chair. We gonna have some fun.
Hi, everybody, and welcome back to the Nikki Alpert podcast. My guest today is Dr. Beth Moore. Hi, Dr. Beth.
Hi, how are you today?
I'm well. I am so grateful for you coming here today. It's interesting because it's rare that I meet somebody first and then they become a guest on my show. So clearly I was a huge fan as one of your patients, and which is hard to say once I tell people what you do for a living, but I am. Okay, so listen, folks. So it's March, and March is Colorectal Cancer Awareness Month, and that's a big deal. And if you haven't started paying attention to that at our age, after this show, I so hope that you do. So Dr. Beth Moore is a proctologist and a colorectal surgeon in Beverly Hills, California. And by the way, it is also Women's History Month. And Dr. Beth clearly is a woman who is the founder of the Colorectal Cancer Center at one of our nation's finest hospitals, Cedars-Sinai, right here in Los Angeles, California. That's a big deal. How did they go so long without you doing that?
Well, it was in the beginning, before everybody would get together to go over cancer patients. So we developed a tumor board where we present all patients with the radiologist, the geneticist, the oncologist, the imaging studies to do the best care for our patients. So we would review all the major, more complicated patients so that we're doing the right thing on cutting edge of care so that people hopefully have good outcomes.
So before that, they just had to hope they could get in touch with other people and share the info?
Exactly.
And then as a woman, you were like, there's a better way to do this? Was that what happened?
It was. I had a really good friend from college who was really good at promoting things. And she helped me put a big design package together, and we presented it to Cedars, and they said yes. And since then, a lot of other specialties have done the same thing.
Okay. I mean, it's amazing to me. I think that my days are filled, cutting hair, shooting a podcast, raising 2 kids. But I mean, okay, that sums up my life. But you have done so much and you find the time to do so much more. I bow down, Missy. I totally bow down.
No, I'm exhausted, just like you are. We're all exhausted.
We are, but I can't believe what you've been able to get done in the 26 years that you've been practicing. I mean, that's a lot.
Well, I work hard.
You
I'm
do.
in private practice. I work 15-hour days most of the time.
Taking care of people, and remind us all, or I know, but tell everybody what you specialize in, because there's a lot of proctologists. And after speaking to you, I found out you can go to the wrong doctor for the wrong thing.
And that is very true. And that's where I help a lot of people because mistakes are being made. So I'm a colon and rectal surgeon. I'm board certified general surgeon, and I'm board certified colorectal surgeon. I don't really claim myself as a proctologist because, I didn't go to proctology school. I went to more than that. So yeah. Proctology is, the butt stuff, and I do butt stuff, but I'm not just a butt person. How about that?
I think the layman thinks that everything from the outside to the butt to the inside is just butt stuff.
Yeah, it is. It's just butt stuff.
But I mean, when you talk about doing laparoscopic and robotic surgery on people's colons, it's a lot more than just butt stuff.
Correct. So I do a lot of cancer surgery. I do a lot of female pelvic floor reconstruction surgery with our female pelvic floor folks over at Cedars. I think you did a podcast with Dr. Eilber a bit ago, and we work together a lot in the operating room doing pelvic floor reconstruction. And we do most of that robotically. And then obviously cancer surgery, I do it both robotically and laparoscopically. So, there's what's great about my practice is there's so much of a variety of things. So you're never bored. That's for sure.
I can't imagine being bored talking about butts all day. And I don't mean to make light of what you do, but I mean, for people like me who are not as smart as you and do what you do, going to someone like you is mortifying. It's embarrassing. And so then you just make fun of it always because it's the only way to get through it.
Right. It's definitely more embarrassing for women than it is for men in my practice. I mean, guys sort of most of the time don't care. You know what I mean? I'm like, I just want to see their butt and they're just showing me their junk and everything. And I don't really want to see that. And they're like, and they'll stand there very proudly and say, well, I'm not embarrassed. And I really wanted to say, well, I am. Yeah, it's a really common thing. I can tell you stories of when I walk into exam rooms and the way that I can find patients.
Okay,
like,
no, let's start there. Let's start there. Yeah. What's the worst thing that ever happened when you walked into a room?
A very famous person, really good looking guy, right? And I tell people, just take everything off from the waist down. And then there's a drape in my office. And I say, just sit there and just cover yourself over in the front with the drape. That's all I want you to do. And I walk in, a very famous good looking guy, and he's laying there completely naked. He didn't unfold the drape. So it's kind of, like this, right? And he just takes it and just, there, and he's just laying there with his hand in the back with this like little square drape on his, I didn't know what to do. I just grabbed another one and said, okay, let's take a look.
He was like Burt Reynolds. Like, you remember Burt Reynolds in Playboy back in the day?
Right. It was
I'm dying.
No, it was that. Or I'll have some guys who will say, well, I said, take your coat, everything off. I'm like, no, I'm good. And I just want to pull it down. So they'll pull their pants and their underwear down and they drop everything to their ankles. And then they'll sit down and they'll roll over and everything's down on their ankles. And when they roll over, all of their money and keys and change just fly out all over the floor. And I got to clean it all up for them.
Which is a better choice than having to look at them bending over, picking up their stuff.
Right. That's why I clean it up. Because I can, you can only imagine what that would look like. Right?
I don't have to imagine. I've seen it because like you say, listen, I've been around a bunch of naked women and I can tell you, I've never seen a woman do that, but a bunch of men have seen it.
They have no idea. Right.
Okay. Now it's time to get serious. Okay, let's go back. First of all, stand up again and show us your shirt, please, because I just saw that as you were standing up.
So March is Colorectal Cancer Awareness Month. So this is one of my shirts. I have many, and we wear blue for the month of March just to promote awareness.
Love that. And I'm going to get into the details of it, but what is your most adamant message for people about this month?
So colorectal cancer doesn't discriminate against anyone. It occurs in women just as much as it occurs in men. It's the third most common cancer in women. So in women, it's breast, it's lung, and then it's colon cancer. It's before ovarian, it's before cervical, and we get that checked. So we need to get our colons checked. So don't be embarrassed or ashamed. Colonoscopies can save you from getting cancer. So you want to get yourself screened. Just like you get your mammos and your pelvic ultrasounds, you need to periodically get a colonoscopy.
Right. Listen, I know a lot of women my age, your age, who haven't done that yet. And men too.
Right. It used to be recommended that everybody get their first colonoscopy at the age of 50. And it changed a couple of years ago to the age of 45 because the incidence of colorectal cancer is going up in younger adults. And we consider younger adults in their 40s and 50s. And we think, well, what are the risk factors? Well, it's got to be something environmental because you don't change your genes. So there's something in the environment and we don't really know. Some people say it's maybe due to processed meats, obesity, or sedentary lifestyle. But I've seen people without any risk factors whatsoever, and surprised they are getting a colon cancer. So this is one cancer, though, that we can prevent you from getting, because we know that almost all cancers in the colon start off as a tiny little polyp or a little growth in the lining of the colon that can slowly grow and get bigger over years. And that's really silent. So when you have these polyps or precursors, you don't know you have them. They're just too small to cause problems. And unfortunately, with a cancer, it has to be really big before you even have symptoms. So we don't want to wait till that happens. The goal is that if there's anything going on, capture it when it is that puny little polyp. And if we see these things, we remove them. And by removing them, hope to prevent you from ever getting cancer.
So have you ever done a colonoscopy when somebody doesn't have any polyps?
Oh, that's more common than not. So we
Oh.
find polyps probably about like 30% of the time.
Okay.
So, 78%, 80% of the time, it's a normal colonoscopy. So if you have no risk factors and we get a good evaluation with the colonoscopy and there's no polyps, then the recommendations by the American Cancer Society are to have it every 10 years. So it's not like you have to have it every year.
Right.
I personally think 10 years is a little too much. I'm like on a 5 or 7 year cycle myself. But if we see polyps or if you have risk factors, then we shorten that interval up probably like 3 to 5 years.
So when you say myself, I know you're thinking about other people, but do you have a male colorectal surgeon or a female colorectal surgeon as your doctor?
So my very first colonoscopy, there was a female associate in my office, and she moved back to the East Coast. So we promised each other that we'd do each other's colonoscopies because we didn't want our male colleagues looking at our butts. We just didn't. So she did hers, I did mine, and they were both normal. But I, again, don't believe in that 10-year cycle. So I got it again 7 years later. But I had it with a male colleague, not the guy in my office because I don't, but a male colleague who sees me quite frequently. And he did my colonoscopy and I had 3 polyps. So now I actually get it more frequently. And so that's why I think that 10 years is too long.
Right. I think so too. For almost anything, I think 10 years is too long to check for everything.
Right.
Especially with the environmental stuff going on. Exactly.
With the environmental stuff, it's not a perfect science. Things can change. So it's just too long.
Yeah. So with the guy who did yours, who was a colleague of yours, are you uncomfortable ever about that? Or are you just like, yeah, you saw my butt, whatever?
So his routine, so we take photographic documentation of certain parts of the colonoscopy, and his routine is that he takes a picture of your butthole, and he took a picture of mine, and I saw it, and I was like, good times. So I was like walking down, I was in the operating room with one of my other female colleagues, and I'm walking down the hallway, and I'm like, BJ, do you believe he took a picture of my asshole? Like, I didn't want a picture of my asshole, but he took a picture. And everyone like around me is like, what is going on with her? It's like, I'm like, dude, like not, but I see him like, I see him almost every day. And I'm like, good times.
Well, it's good to know that even in your field amongst each other, it's just like, it's so embarrassing. We got to make fun of it. I love that that's just how it is across the board. I mean, we are who we are, right?
We are who we are. We all, we're doctors, but we're also human beings and we're patients, and we can get cancer just like everybody else. So we have to do it. And why not do it with somebody that who knows what they're doing?
Yeah, exactly. Well, that's for sure. I just to piggyback on that, a friend of mine sent me some photos the other day, and they were all these. It was like a snapshot of like 14 photos, and it clearly was the inside of something. And I was like, Stace, what is this? She's like, it's my butthole. And I was like, oh, thank you very much. It was all nice. No polyps, the 3 polyps, they removed them. I'm fine. And I'm like, good to know. Thank you very much.
I know. Just put that on a magnet on your refrigerator, right?
Yeah, right.
You go to a doctor's offices or hairdresser's office, and they have the picture of the movie star on the wall with a little autograph and stuff. It doesn't happen in my office, unfortunately. It just doesn't happen.
But it should.
It should.
It definitely should. Oh my God. Okay, so I do want to sort of talk about like all the humor that must happen at the parties when people ask you what you do. But if we have time for that later, I want to do that. But I really want to get into the importance of what you do and all of this. I hate to do this, but I'm just going to put it out there. 57 years old, had a couple of kids, work out hard. I went to see Dr. Moore I can't even say the word, for the dreaded H word. I went to see her for a hemorrhoid. Mortifying. Like, I am starting to schwitz just saying that. But I'm going to put it out there because I have told several friends of mine, and I don't think I have one friend who didn't say, oh my God, I've had that, or I have that now, or can I go see her or something. So let's talk about the dreaded hemorrhoid and the fact that at some point when you were fixing me up, you said to me, let me take a look at all three. And I was like, three? I have three hemorrhoids? What do you mean? And then the answer to that surprised me, that everybody I shared that with was like, what? So fill us in.
So we're born with hemorrhoids, everybody, unless you're born without a butt, which can happen, but we are actually born with hemorrhoids. And we have two types of hemorrhoids. We have inside hemorrhoids and we have outside hemorrhoids. So the inside hemorrhoids are cushions of tissue with lots of little baby blood vessels tucked up on the inside. And they're like the inside of your mouth. They're like red and wet and like cushions. And these are the ones that bleed. But they're up on the inside where there's no nerve ending. So we can do all kinds of little tricks in the office to help with that. Because it doesn't hurt with what we do, or minimal pain with what we do. Now, all the way around the butthole, underneath your skin, are your outside hemorrhoids. And those are cushions of tissue with lots of little baby blood vessels under your skin. And that's where all of your nerve endings are. So when they flare up, they hurt and they can swell and you can see them. And those are common ones that we see for women who have children. Because during the pregnancy, as well as during the delivery, you can get really bad external hemorrhoids that really swell up and cause a tremendous amount of pain. And when they swell up, they stretch out your skin. So when all the swelling quiets down, you're left with all these like skin tags around the tush. So that's a common thing if you've had a lot of children. And, that could be annoying. And if you get older, sometimes a lot of women may not feel sexy around that. It's common that
but beautification comes in, right?
Yes, right.
I want to talk about that after.
Right. So it's common that we kind of get that a little bit better. So we all have hemorrhoids. It's just a matter of if the degree of them and what your symptoms are. But I can honestly tell you the best technology that's going to keep me in business forever is the cell phone, because everybody sits on the toilet forever on the cell phone. And when you sit on the toilet, you're sitting in a hole, which makes your hemorrhoids swell up and cause problems. So because of everybody sitting there for so long, it keeps me in business because people have butt problems. So thank goodness for the cell phone.
Okay. But on the other hand, there's so many reasons not to bring your cell phone into the bathroom when you're sitting there for so long. Are there not?
I bet you people don't wash their hands when they're all using their cell phone. I'm just telling you. But cell phones are very, very, it's like the new man cave for the most part, but it's a woman cave too lately. So a lot of people sit on the toilet for long. I can't. I'm too busy. You're a mom.
You're too busy to sit on the toilet for that long.
Right. You're a mom. You don't have time for any of that stuff.
You don't. You're never alone in there anyway.
I wasn't alone in the bathroom with my kids for at least 6 or 8 years. At least.
Absolutely. So sitting doesn't do it. It just means when you're sitting and there's like nothing holding.
Right.
Okay.
It can cause, if you have already predisposed to hemorrhoids, it just makes them swell up because you're of the pressure.
Okay. So when I was there and I was a nervous wreck and I was talking to Juan, your sweet, loving, kind soul of a man who's your nurse.
He's a great guy.
Oh my God. He said to me, don't be afraid. Anything you have to do. Dr. Moore uses pediatric tools on women. Now, besides the fact that that's just a thoughtful big deal, you told me everything you were doing and you swore I wouldn't feel anything and I didn't. And I just, besides thanking you, I think that has a lot to do with being a female doctor. Are there very many female proctologists?
In the country, no, but in this area, there's probably, I think, 4 of us in this area in Los Angeles.
Out of how many proctologists? I'm sorry, that's not a good word. Out of how many colorectal surgeons?
So at Cedars, there's 3 of us at Cedars out of 13.
And is that the average percentage?
I think we have a little bit more.
Okay.
For sure.
If any of you are thinking about becoming a colorectal surgeon, ladies, please do it because we need more of you.
We need more, right? Exactly.
We sure do. Okay. So we stumbled upon butt beautification, which number one, fixing a hemorrhoid, it's a big help. But then now when you mentioned that to me, The only thing I know that I could figure out it went into, and I remember hearing about this years ago, was bleaching of your hole.
Right.
And I remember thinking, dear God, if I have to think about my neck and my jowls and the back of my hands and my butthole, like how do I have time to take care of anything else in the day? Who does that?
But anal bleaching?
Yeah.
Well, let's just talk about in general butt beautification. So people that care about, what they look like.
I mean, I
do. Yeah, but I mean down there. Right?
Okay. I do.
Oh, okay. So, I mean, common people are porn stars, obviously, gay men, and believe it or not, newly divorced middle-aged women who
That makes
had
sense.
babies. Right. It makes sense, right?
Yeah,
So they
yeah.
had babies, they developed hemorrhoids, they have all these things. They've been married for years, so like they don't care what their husband, cares about, right? At the stage of the game, they've been together for so long, but now they're back into the dating scene,
Right.
and they want to feel good about themselves. So those are probably the most common, but everybody, it goes across the board.
Okay, so is that what butt beautification is? Smoothing out and bleaching?
Yeah, for the most part, just making it look better and getting rid of like excess skin.
How long does it take to bleach your butthole?
Oh, it doesn't take very long. You just put on this special product, and then it lasts. You do it a couple times, and then it lasts for maybe about like 6 to 12 months. And then you have to do it again.
Wow.
Yeah.
So you don't do it?
I don't do it very often. My associate does it, but I don't do it very often. I do mostly like tags and stuff.
Okay. And I meant, did you do it? Like, have you had yours done?
Oh, have I? No, I haven't had mine done. So
Okay.
I'm happy with my butt.
Okay. I'm so glad to hear that. And the other thing I thought of once when I was having friends who were talking about having vaginal rejuvenation, and I don't mean for things that are a problem, but I mean just to make it look better. I remember saying to them, seriously, woman, if you take your pants off and somebody who wants to see all that gets to see it, they're happy. And unless they, especially at our age, unless they've got like a mining hat on, they can't see it anyway.
Right. They don't care.
Yeah. I mean, if they're getting in there, it's all good.
Right. I think that, I think women were just more conscious of all of that. But I think in general, if a dude's getting it on, they don't really care. They're just happy that they're getting it on for the most part, but it's also like, we don't, you can compare each other's faces, right? You can compare each other's boobs. You can compare each other, like those things, external things, but no one really knows what other people's butts look like.
Right.
So I'll have some people come in and say, oh my God, it's like the biggest giant hemorrhoid in the entire world. And it's like this little tiny little thing. And it's like, because they don't know,
right.
They don't have anything to, in perspective to, compare. So if you say, you know what, I see butts all day long, and you're actually pretty normal, then it's actually a little bit of a relief for that person.
Sure.
Because they think that they're not, something's not the matter with them.
Right. Well, have you ever seen a butt and been like, we do this thing? Have you ever suggested butt beautification after seeing somebody be like, oh man, Juan, what's going on in there is not to be believed?
Well, no, not really. I let people decide for themselves, because I have some people who they have this tiny little thing and they're like, oh my God, it's the end of the world, and they want it removed. And then I have stuff people have, hanging down to their knees and they don't care. So I never talk anybody into it at all. So if you're having any surgery done in the tush area, removing skin tags or doing those things, it is incredibly painful afterwards. The recovery is very painful. So that's why.
Oh, because of the pain, because of the nerve endings.
Nerve endings. Right. So I never talk anybody into it. And people, the more you do, the more it hurts. So people have to understand that, because, you typically have to take, depending on how much, but at least a few days off work or doing anything.
That's terrifying to me. And I remember I had to take my father to get disimpacted.
Yeah.
And I don't think a lot of people know about that.
Yes, it can be a family affair, because it's usually the child that has to take the parent to the doctors.
Yeah. Do you want to give a quick rundown of what that means, so people know that when their parents have, listen, we all take care of our parents, right? So just in case, do you want to give a quick rundown of that?
Well, as we get older, we're much more prone to constipation. And especially medications can make us constipated. Being immobile can make us constipated. Our sensation is diminished down there, meaning like you can't sense that there's like poop down there. And then our pelvic floor muscles get weaker so that we can't evacuate. So it's very common in the elderly to having constipation. And if they don't, so we have to put them on a bowel regime. But sometimes that fails where they get impacted. So that means that you get a whole bunch of stool, like basically a giant ball of stool in the rectum that just can't come out.
Because all the moisture gets absorbed and it gets rock hard.
Correct.
And
then
gross.
You just have like a really hard stool. In general, they have hard stool in general. So the only way to get that taken care of is that you have to just manually dig it out.
And when she says manually, folks, she means manually.
Manually.
Because they told us about that. And my dad was mortified.
Yeah, it's a big deal. It hurts, a little bit. It's not pleasant. We actually have a lot of, we light candles a lot in our office for something like that because, everybody knows it's happening kind of a thing.
Yeah.
So, yeah. So, you got to do what you got to do, unfortunately, but there's really no other way of doing it. Taking care of that. I think in your case, it's better to receive than give. I'm not sure in that situation. Maybe it is.
Okay. So you talked about how their bowel habits change, and you and I discussed normal bowel habits, which I don't know anybody who has the exact same bowel habits as I do, and I don't have the same as most of my friends. So what is the normal bowel habit, or how do you explain that?
So normal is a huge range, and you're right. We're not all the same, and everybody's metabolism is different. Their diet is different. Their medications are different. So normal is anywhere from 3 times a day to 3 proud of you, to 3 times a week. So the key with that is that you don't want extremes, meaning days to go by pooping rocks or having diarrhea. So both those extremes are where we have to sort of like maybe try to help you out.
Right.
And it's just a matter of sometimes it's diet modification. Sometimes we have to put you on mild laxatives. And don't compare yourself to, your spouse or your husband. So in general, guys are probably more regular than women. Like every day there's Bob at 8 o'clock in the morning and he has a bowel movement every day. Women can fluctuate a lot, meaning that we go and then we don't go, and then we go and go, and then we don't go. So having these little baby fluctuations is normal. So if you don't go to the bathroom that day, don't panic that, oh my God, something's the matter with me. It just may be who you are. It's maybe your metabolism.
Right.
But if you don't want, like I said, days to go by or really hard stool or straining in order to have a bowel movement, then we just high fiber diet, lots of water. And if that doesn't work, then we put you on some like mild stool softeners or something.
Right. And then of course, if you go on TikTok, you can see all the people who tell you all the magic tricks to making a poo.
Right. And there's like, but you don't want to, like I said, don't force yourself to go to the bathroom. The biggest myth that people say is that you build up like toxins and plaque inside of you and you need to do colonics and stuff. You actually don't build up toxins or plaque. The most important thing for your colon is really what it sees in its lifetime, right? So a good healthy diet, particularly like a Mediterranean diet, not a lot of smoky meats, not a lot of processed food, high fiber diet, and a lot of water. So that's the most important thing, is what your colon sees in its lifetime, not doing colonics. I'm not a fan of colonics.
I have never had one. And the people who do cleanses and colonics to begin with, and vaginal steaming, like they're all the same people. And they aren't they? They are. They're just all the same people. And I don't get it. What do you have to say to them?
Well, they already have a mindset of what they want. So I don't really try to talk them out of it. I just give them a reason why they don't necessarily need to do it, but it's a choice.
Yeah.
But the lining of your colon gets shed once a week and you get a brand new set of cells every week and you don't build up toxins.
And does that shed per poo? It's the whole week of its shedding, or?
Yeah, it's just like your skin, your skin sheds cells every day. You don't really necessarily see it coming off, but these little, you can't see it.
Right.
But it gets shed and then you get a new set of cells.
That's kind of cool.
Like just like anywhere else in your body.
I sort of like that idea.
Yeah, me too.
So we talked about hemorrhoids, but you discussed with me that we wanted to talk about rectal bleeding. Now, I have also had that problem before. So I'll start there just to let you guys know everything as far as TMI goes. When I was 40, my mother got very sick. And 2 weeks after she passed away, and it was we found out she was sick on January 4th and she was gone by March 14th. And with the nation's second leading killer, lung cancer. And which she didn't have checked for and all that stuff, all the same reason. And the reason I do this now. And it was my husband's birthday and it was 7:00, which is not usually when I go to the bathroom. And I had this urge that I had to go immediately. And when I sat down, blood poured out of me. And I, thank God, have a relationship with my internist where I have his cell phone number because I cut his hair. And we're friendly. So it was 7:30 at night on like a Tuesday. And I called him and I was like, Mitch, are you eating? No, I am on the toilet. And a bunch of blood is pouring out of me. Horrified. My husband's standing next to me. And he says, what color is it? And I said, it's bright red. He said, you're fine. When you're done, put a pad in your underwear, go to dinner. I'll tell you where to go tomorrow. So the next day I went to this very handsome, beautiful soul of a doctor who was probably 30. Talk about mortifying. And he does this thing while I'm dry heaving in a bucket. And he says, it's a fissure that you've probably been so tense. And it might've started when you were carrying the children, but with all the tense and the sadness and the grief, 2 weeks later, it just popped. And I had to get a sigmoid flex, which was also mortifying. Because he said to me, which was lovely, if you were my sister or my mother or my daughter or my wife, it's just a fissure, but I would want to do a sigmoid flex to make sure it's nothing else. So let's just say I called you instead of Mitch that day. What would we have done?
So I would tell you the same thing. Don't panic. And then we would just evaluate you the next day. More than likely, something that comes on like that, most of the time, everybody goes for the bad word, right? Everybody goes for the cancer, right? Mm-hmm. So most of the time it's not cancer, but you don't want to be that person. So obviously the most important thing is to get examined. So the more common things are benign things like hemorrhoids or fissures, which we can talk about. You can also have colitis that can do that. And then the least common is cancer, but you don't want to, the most important thing is you don't want to assume that it's not cancer. Right. I mean, you don't want to panic over it, but you just don't want to blow something off. Mm-hmm. However, look, if you have an acute event and you have some bleeding or some problems, certainly get evaluated. But if it goes away, then it's probably not cancer because cancer just doesn't hide again, So if it persists, don't always blame it on your hemorrhoids. I couldn't tell you how many times people say, oh, I've had hemorrhoids, and it's bright red blood, so it's got to be hemorrhoids. And then lo and behold, they've had a rectal cancer. That they just, blamed it on something else. So you definitely want to get examined and evaluated just to be on the safe side. Mm-hmm. Most of the time it's benign, but you don't want to be that 1 or 2% where it's not.
Yeah. Yeah. And by the way, just for those of you who've never had a sigmoid flex, it's a bendy tool. So it's easily bendable. So you're awake when they do it and you can watch your whole thing happening, which I didn't because I was too busy with my head in the bucket dry heaving. Mortifying, but totally doable. Grateful that I did it. Hope I don't ever have to do it again.
Right. No.
Right. Okay, so to back up and talk about butt beautification, you also mentioned butt Botox. And I was going to look it up, but I thought, boy, I just want to see what my reaction is when I find out why people do butt Botox.
So your butt doesn't blink anymore and you don't have any wrinkles. No, I'm kidding. I'm kidding. So we'll go back to what you're talking about, the fissures, right?
Yeah.
So fissures it's a bad tear right at the anal opening. It's usually caused from having like really hard bowel movements or constipation, and it tears open, can cause a tremendous amount of pain and bleeding.
I had none of that.
Yeah, I don't think you had a fissure actually, but I'm not going to say anything.
We'll talk about that after maybe.
Okay. Yeah.
Okay.
But it 99% of the time it's pain and bleeding. It's associated, or at least pain. So when you go to the bathroom, people tell you it tears open. I'm feeling a tear when I go to the bathroom, and that's a bad fissure. Fissures are the most common cause of bleeding in kids, actually, because they're prone to constipation. So the key with that is obviously to get rid of the hard stool. That's not as simple. And then the longer you've had these bad tears, you have two muscles. You have an inside muscle for control and an outside muscle. So your internal sphincter muscle, you have no control over that. And as these fissures get worse, the muscle goes into spasm. And when it goes into spasm, it keeps tearing it open, preventing it to heal. So we actually try topical ointments to try to break that spasm. The common one I use is called diltiazem. If that fails, we used to do surgery. And surgery is where we would go to the operating room and cut part of your muscle for control to break the spasm to allow the fissure to heal. The surgery is 95% successful, but we are relaxing part of your muscle for control. And about 5 or 10% of people can get that, can have occasional accidents of gas or a little bit of seepage. So people, right. So nobody wants to do that. They'd rather live in pain than to do that unless it's so bad. So the new kid on the block, and we've been doing it for probably about 4 or 5 years now, is where we actually inject Botox into the muscle and break the spasm with Botox. It's an easy office procedure. The biggest, there's really no downside to it as far from a medical standpoint. The risks are incredibly low. There's 2 tiny little needles. It literally hurts for like 2 seconds each shot. It's only about 50 or 60% successful, but it's better than having surgery.
Right.
And the biggest downside is that it's expensive and your insurance company doesn't pay for the Botox.
Well, Botox is expensive because I have had it in my forehead, and that's expensive. And so you do it probably 3 or 4 times a year as well, right?
So probably the people that we do it on, about maybe 2/3 of them have good to excellent results the first time around and don't need a repeat injection.
Oh, wow.
Yeah. And then, probably about 1/3 of folks, because it only lasts about 3 months. And then 1/3 of the folks that it works on need a repeat injection.
That's just wild. I mean, to think about it's enough to think about how smart scientists are and doctors are, but the people who are innovative enough to take things that we know work in one area and make them work in other areas, it's just astonishing to me.
Right.
I mean, maybe that's simple for you because it's something you do all day long and people you hang out with.
No, because medicine is growing by leaps and bounds over the last 10 years because we're merging with technology and industry for good and for bad, right? I mean, it's for profit, understandably, but because of the merger, that surgeons in particular can say, I'm having a problem with this. And then the engineers from industry or technology can help us with those problems so that we're working a lot together to figure out how to make something better, hence, robotic surgery.
And that's a whole different, that's just crazy.
Yeah. So it's crazy. And then in medicine now, we're getting down to such a molecular level, particularly with cancers, that we can tell you what chemotherapy agent will work and what chemotherapy agent won't work. So we don't, give you something that, waste your time, as well as, potential toxicities. So there's a lot of it's all the way down to the molecular level now of how, so it's growing a lot faster than ever before. I can't keep up with it. I mean, I'm glad I'm only in one field because
but then you can't be great at something if you do too many things at once anyway. And proven by the fact that you are now speaking to people, engineers of other areas, because a team is always better focused on one thing.
Right. Exactly. Right. You don't want to be a jack of all trades. You want to be the master of one thing.
That's how you do the best kind of work. I mean, come on.
So you try.
Yeah. So when I spoke to Juan about things that I thought were important, and I asked him what was important, he introduced me to something that I never knew about, which is that men come in for HIV screening and anal pap smears. Right.
But it's not just men. It's men and
I guess what? I take that back because I am smarter than that, but I take that back. Okay. Sorry.
Yeah, no. So anal cancer and vaginal cervical cancer, the number one cause of that is the human papillomavirus. Mm-hmm. So the human papillomavirus is sexually transmitted. And that's a cause of warts as well. Mm-hmm. So there's different subtypes of this virus. Some of the subtypes are more prone to getting warts, and some of the subtypes are more prone to getting cancer. And you can carry both of these around. So, and like I said, it's the number one cause of anal cancer. So with women, we do cervical pap smears, right? So a pap smear is just basically scraping of the cells in the cervix, looking for precancerous changes associated with this. And then when you see that, you go and seek and destroy, right? So you'll do like a colposcopy, or you'll do what's called a LEAP procedure to destroy those areas to reduce your risk of getting cervical cancer. So we do the similar thing in anal cancer, where we first look with our eye and make sure everything looks okay, but then we take a scraping of the cells and look at the cells under the microscope for these precancerous changes. And if we see these precancerous changes, which is called dysplasia, then we sort of seek and destroy. So we bring it, I do it in the operating room because I think it's more comfortable, but we find these areas with like a microscope and these little stains. And if we see these precancerous changes, then we take a biopsy and then we burn them or destroy them to hopefully prevent you from getting cancer. It's a little controversial whether you should do it or not. There's not a lot of good studies that are out there, like head to head. Like we don't take one group of people and do it and the other group of people and we don't do it. But there's one study that's coming out that hopefully will give us better information with that. But it's the only thing we have to offer to hopefully prevent you from getting anal cancer. So obviously we do it for men who practice anal sex. But even for women, if you don't practice anal sex, but you have the wart and you have a history of cervical dysplasia, just the proximity of the anus to the vagina, you can get HPV from having vaginal sex in the anus.
And there are so many jokes about the closeness of that whole playground in the mud box or whatever. But why isn't that just common practice while you're getting a colonoscopy to take a pap smear of the anus?
Because a lot of people, it's not a common thing that people do. Like you'll see it mostly on the coasts, like the East Coast and the West Coast, because there's more of an HIV, gay men environment there. But I think it should be for men and women. And again, it's controversial a little bit. Some people do it and some people don't. Some people are more in the watch and wait, like just doing regular anal rectal examinations. But it's just under talked about. For women, it should be talked about more. People think that women have to have anal sex in order to get anal cancer, which is a complete myth. And you can carry this virus forever. I'm a believer that a lot of women and men carry it forever, and we just don't have the technology to detect it. There's not a blood test to detect it. Because I've had women who were in their 70s, 80s, and 90s getting anal cancer, and they haven't had sex in like 40 years.
Right.
So clearly they've been carrying the virus, that whole time.
I remember when I got my kids the HPV shots, and they were like 3 when their doctor suggested it. And I was like, they're 3. And this is new. I'm not doing it. And since then I've heard bad things about it and good things about it. But I remember when we were driving to I can't remember if it's a series of 2 shots or 3 shots, but I remember they were painful shots for my kids. And we were driving for the last one. And my son said to me, and they were little, they were not 3, but they were probably 12 or 13. And my son said, if I don't have a cervix, why am I getting an HPV shot? And but what I said was, because a lot of men don't know they have it. And because when you have sex with a woman, if you have it, you can give it to her.
Right.
And if you had sex with a partner who didn't know she had it, then you carry it and you are the supplier. And it's not right. And so we just want to make sure that you don't kill anybody. And he was like, gotcha.
Right. Exactly. My kids had the HPV shot. So it used to be 3 and now it's 2.
Okay.
And a lot of states are trying to use it as like the sex shot or the sex vaccine, like promoting sex, and it's not promoting sex. It's actually being preventative. I mean, just like you get the hepatitis vaccine, right? It's, that's sexually transmitted. It's sexually transmitted.
We're not promoting
virus, right?
needle use.
Right. We're not, you know what I mean? So it's like all these things are preventative. And with the vaccine, in general, the idea is you have to have the vaccine before you get exposed to the virus. And the vaccine doesn't protect you for remember I told you there's different types of the virus?
Yes.
It doesn't protect you for every single one. There's almost 200 subtypes, but it protects you for the most contagious ones causing warts and the most high risk ones that can cause cancer. So
like every vaccine. The flu vaccine can't cover you for all. The COVID vaccine can't cover you for all of them. We know this.
Right.
If you are a believer of science anyway, right?
Right. But
okay.
Anyway, I keep promising my kids, I'm going to make a video of every STD out there, the ugliest ones around, and say, here, be safe, wear a condom, be protected, because you may not remember that guy or that gal's name, but they're going to give you something for life.
That never goes away.
Never goes
Yeah,
away.
seriously. God, I remember having those conversations, and not only that one, but with my son when they were going to college. And I said to him, look, you may go to a party and you may see some girl passed out at a party, and be the guy who finds her best friend and says, take your friend home before something terrible happens to her. And if the girl needs a ride, do not take her by yourself. Take her with a group of girls so that all you are is the driver, and they can carry her to the car and carry him out of the, you don't want to touch her. You just want to be the guy that you hope would find your sister at a party and take care of her.
Right. Exactly.
So you just always be that guy, guys. Just take care of your junk. Make sure you don't give anybody anything. And I don't know, use rubber.
Right? It's not that hard.
It's not that hard. No pun intended. Did I miss anything that we wanted to talk about? I mean, we didn't talk about farting.
Oh, I love farting.
Okay, can we talk about that, please?
Right. So it's okay.
I love farting.
I love farting. So they've actually done studies on farting, and the average person farts 15 times a day. So farting is a normal, healthy part of your system, your GI tract. So farting is good. I mean, all right, I'll tell you a secret. So I'm a farter. I fart in elevators, and then I get out because it's the only time that I can do it by myself. So don't tell anybody that.
Yeah, we'll make sure nobody hears this part.
Right. But I mean, but yeah, farting is good. We fart in our household. There's a lot of households that don't fart in front of each other. Can you imagine? It's very, very common. It's common that the guy can fart is okay, but the woman's would be mortified. It's like one of those taboo things. So it's common in many cultures not to fart. But I always look at farting as a sign of love. Like, you always know, like, you're dating somebody for a while, and like you're like holding it in, and then like who's going to be the first farter out there, because as soon as someone farts in front of you, you're like, oh, we made it through. We got that hurdle. Now we're in love with each other. It's a sign of love.
Oh, I was once watching something on TikTok when I was gone down the rabbit hole, where there was a very famous rapper whose name I will not mention. And he was talking about how he dated a girl for like 5 years and she had never farted. And it occurred to him that he couldn't trust her, because if she could hide a fart, what else was she hiding for 5 years? But here's a more interesting thing. I can be with my girlfriends who I've grown up with, my forever girlfriends, and we can be walking from like wherever to wherever, and just a big, loud, horrible fart rips. And my girlfriend's like, yeah, sorry. So what happens and we don't care, like, it's funny. And yes, there are some women I know, and my daughter is mortified. If I ever do it, she's mortified. But what happens when you just can't hold that in anymore? And like, you don't know it's going to be loud, and you're like, what happens that you lose control of that and it slips out and you didn't even know it was coming?
I hate when that happens.
Yeah, tell me about it.
It happens as we get older. It happens more commonly for women because,
the pelvic floor.
Pelvic floor. Even they've done studies with your first vaginal delivery. If everything looks completely normal, no episiotomies or nothing, that there's actually about 20-30% of women have actually a small sphincter defect, even with delivery, that they can't detect by doing ultrasounds. So we can compensate for that for a long time. And then as we get older, we can't compensate for it. So, you have a little piddle that happens sometimes, and you have a little fart that happens. I just say, get a dog, blame it on the dog or cat. And again, ladies, don't be embarrassed if you fart when you're having sex, because the guy can't hear it anyway. He's busy doing his own thing. So don't worry about it.
And by the way, he could hear it, or the woman could hear it, depending on who you're having sex with, and depending where your head and ears are too in that whole situation. Right. And by the way, there's also the oh my God, what's the word when air comes out of your vagina?
Oh, yes. What's the word? It's
I call it a vart, but that's not what it's called.
It's not. I forgot. My mind is blanking on that.
I was once doing an improv class where I did a whole spiel on varting upstairs, and it was ridiculous. But it is mortifying. And should you be mortified? No. In fact, when I first started dating my husband, we were like on our third date, and we had our first kiss. We were standing in front of the Palm waiting for our car. And he said to me, I got to tell you something. And I said, what? And he goes, I have such a good feeling about this. And if I'm right, I need you to know something. And I just thought it was going to be this, like, beautiful thing. And he goes, if you're ever at my house and you need to fart or you need to go to the bathroom, please don't hold it in, because I have dated women who've like spent the whole night holding it in and they go home with terrible stomach aches. He's like, I don't care if you fart or you burp or you have to poo. I don't care. And I was like, oh my God, phew, thank God.
Right. You found, your prince.
Seriously, like for nothing else. And I'm glad I married him for that. Okay. And the other question that my children came up with was, why are some of them so loud and ridiculous but don't smell? And then you got the silent but deadlies. What's the difference? Is there a difference?
It depends on what you eat and your metabolism. So it's a combination of that. So like cabbage, it's more deadly. Beans are more deadly. Everybody's metabolism are deadly, are different rather. I mean, I'm sure you have, I'm a loud farter, but I don't typically smell. And my girlfriend, don't tell her, but she's
stinky.
She's the opposite. She's the opposite.
I'm sure she'll be very happy about this.
Yeah, she's not going to watch this. I won't.
Okay, good. But I mean, I think most of us have had a little bit of both anyway. It is mortifying, but it is funny. And I hope to God, guys out there, women out there, that you find the humor in it and in all of this, because it's all so important. It's all so human. And we're all exactly alike, but none of us are free of any of this, not from cancer to farting. Right. And, just get your shit taken care of. That's our closing message. Get your shit taken care of.
Get your shit taken care of. Get that colonoscopy.
I mean, seriously, okay, I do have one more question that you may or may not want to answer. And if you don't, I'll just get rid of this. But I have heard several stories about people during medical school having to take things in the emergency center out of people's butts. I don't know how it got in there. I don't know how I fell on a Coke bottle, or I don't know how the Star Wars character got lodged up my butthole. Did you ever take anything crazy out of someone's rear?
All the time. But remember, this is like, you go back to like survival, right?
Yeah.
It doesn't happen in women. It's only a guy thing. They're just so stupid. I mean, like, you know what I mean? Like if it goes up, it has to come out one way, and they're just so stupid. I remember there's one time where a straight guy, he was having a problem with erection. So he was told that if he shoves something up his butthole, he can get a better erection. So he shoved a spray can up his butthole.
A spray can? Right? What do you mean a spray can?
A spray can.
Like a spray bottle?
Yeah, spray can.
How do you get a spray bottle up your butthole?
Well, he did. I guess he was drunk. I don't know, but he did, and he couldn't get it out. And he waited for a couple of days because he was embarrassed. And his wife was an administrator at a hospital, so she took him to a different hospital. And we couldn't get it out at the bedside, so we had to go to the operating room and get it out. Fortunately, I was on call, and I had very small hands. So guess whose job it was after he was under anesthesia to basically, pretty much put my whole arm up the guy's.
I was going to say, how high did you have to put your arm?
My elbow to get it out. So I got it out. It was pretty high up. So I got it out, and we finally got it out. And then we have to make sure he didn't have like a perforation from it. And the can says, Euphoria, 30% more.
Oh my God. Okay. I want to know who the horrible human being is that told him to do that. And also what the moron what his IQ was, who thought that was going to work.
Well, it's a dude. They do it all. I've taken out Tylenol bottles. I've taken out pens. I've taken out paint rollers. I mean, you name it. Yeah.
And what are the stories they tell you? What's the funniest story you heard about how that happened, which you're just like, dude?
Oh, well, I was climbing the ladder and I happened to fall. Oops. I mean, like, what can they say?
Oh,
so,
my
and,
God.
And seeing it on x-ray is quite interesting too.
Oh, you've got to keep those pictures on your phone for parties.
I should. I haven't, but I should.
Oh my God. I just want to come spend the day with you and just hear all those stories at one point. I think lunch I could handle it over. I'm not sure.
Yeah. We talk about it while we eat. We don't care.
Of course you do. Seriously. Oh my God. Okay. This has been so fun. And I know that it wasn't really, most people don't think talking about all this is fun, but This is what I do. I talk about stuff that most people don't like to talk about. And I talk about it because I can find the humor in it. And most of the time when I find somebody who wants to talk about it, we do. And so if you made it all the way through this video, I am so grateful. And I hope to God that you learned a lot from Dr. Moore. She has so much to offer and more. And I will put all of her information so that if you want a new doctor, you can go see her. And I highly, highly, highly recommend her. And I've been to a few different ones, and nobody has helped me like she has. I don't know what else I can say about you other than I am so glad that I found you. I find you hilarious and smart and charming. And I am so grateful that you gave me the time on your day off when you're so busy. I don't think there's anything else to say, is there?
No, well, thank you for having me. It definitely is an important topic, and you have to make light of things, and we're all human. We all fart, we all poop, so it's a good thing.
It is a good thing, and this conversation matters, and that's why I wanted to have it.
Thanks for having me.
Thank you so much.